I'm Allison Roeder with the Olympic Educational Service District 114, also known as OESD. First, I'd like to thank Maury Lewis and the Kitsap Community Suicide Prevention Coalition for arranging this great opportunity for us today. The Kitsap Community Suicide Prevention Coalition is a large group of individuals and organizations across Kitsap County working together to address the public health issue of suicide. We're fortunate today that we have a couple of the organizations from the coalition here to answer 3 questions to help provide information to the community. The first question will be, what has your organization done this past year to help reduce suicide? The second question is, where did you get the resources to do what you did? And the last question finally will be, what resources do you need to do more of the work? So I'll begin by talking about what our organization, the OESD, has done in the last year to help reduce suicide. So as a member of the Kitsap County Community Suicide Prevention Coalition, we participate in the planning meetings, as you all do as well, and provide the education lens when we're talking about policy, procedures, and the role of schools relating to suicide prevention. We also serve as the liaison and sometimes provide information. So when we had the youth poster contest, we were able to provide information to the schools to increase youth participation in that opportunity. We also have trainers at the OESD that use 2 research-based proven effective suicide prevention programs, Networks for Life and Signs of Suicide. And those are both offered to school counselors, school psychologists, nurses. That was legislation, House Bill 1336, a couple years ago that required those individuals to have that training, 3 hours worth each 5 years to keep their certification. So in addition to that formal training, the 3-hour training, we also offer by request to schools who'd like us to come in and do all staff training. And really the goal is to increase capacity for awareness and intervention opportunities for teachers and anyone else who works with our students on a daily basis. We also, regarding training, offer parent training, and we were able to do 2 of those last year here in Kitsap County, in Central Kitsap and South Kitsap. And the purpose is the same, but we're gearing more towards connecting parents with resources and an awareness on when they have concerns about their child, what to do about that. We also offer training for students in the way of peer-to-peer intervention programs. So if they have a peer suicide prevention club, they'll bring us in and we'll talk to them about not only the awareness, but also involving adults and connecting their peers with resources. So in addition to that, we also provide direct services by having what we call the student assistance professionals in every high school here in Kitsap County. And they work with students who are struggling with mental health or substance abuse issues. And often they interact with students who are presenting with suicide ideation. So last year, in fact, they had a total of 51 visits for students with suicide ideation. So question number 2, where did we get the resources? Our work is supported by the Kitsap County Mental Health, Chemical Dependency, and Therapeutic Court 0.1% tax funds. And what resources do we need to do more of this work? We would need to figure out a more sustainable funding strategy to support the work that we do. And in addition to that, the current funding ends December 31st of this year, and we won't know until the end of September if we have continued funding through that program. And also I would just add, besides monetary resources, I think we also need to have a greater awareness and community involvement just by way of people being present for the conversation. I'm sure you would all agree that we all have a personal passion for this and the work that we do, and we need everybody in our community to be having that same passion and have the same conversations. So with that, I'm going to turn it over and introduce Josh Gose from Coffee Oasis Crisis Intervention Program. Josh.
Thank you. So over the last year, we have been working on creating a program specifically designed for youth. We entered into the crisis intervention where we created a team in order to help youth where they're at with suicide. So we did that in 2 factors. One was we work with community leaders, first responders, law enforcement, fire, social workers in the hospitals and also in the schools to work with youth that are having thoughts of depression, suicidal ideation, and trying to get everybody on board. So we create wraparound services underneath those youth and create a better flow of communication so that those individuals that are supporting those youth are have more knowledge and information. The other part of our platform is that we have created a crisis intervention line. So it's the Oasis crisis line, which serves youth 13 to 25, and they can call in between the hours of 4 p.m. and 8 a.m. And so we have both adults, and we also partner with South Kitsap High School to do peer-to-peer support for those youth. So it's been a phenomenal program so far, and it's been a great learning experience for us. We get our funds for our programs through the 1/10 of 1% grant, and what we need to do more, or how we need to progress. What's the next one?
What resources do you need to do more or continue that work?
So we are always looking for donations to come into our centers. That's how that's part of our funding source for our youth programs. We also are looking at, we also work on creating more grants, as well as asking for more in regards to the 1/10 of 1% grant, because we would like to bring on an additional therapist to work with our youth. We want to bring on a substance abuse counselor to work with our youth. And then we also are hoping to bring on a text-based crisis line. One of the things that we learned through this crisis line is that youth generationally right now, they don't really pick up the phone and call. They're more comfortable with texting. I mean, that's kind of the way the world's working right now. And so once we get a text-based crisis line up and running, we're going to be able to meet a lot more youth.
Excellent. Thank you, Josh.
And so without further ado, I'd like to introduce Kelly Schwab of the Crisis Clinic of the Peninsulas.
Hi. So as he said, I'm with the Crisis Clinic of the Peninsulas. I also run a program called Peninsulas 211, and we're part of Kitsap Mental Health. The Crisis Clinic has been in this county since 1965, and what we do as far as the Crisis Clinic really hasn't changed that much. We are there to provide an empathetic ear to anyone in need. Now, we're part of the National Suicide Prevention Lifeline, so that we do get suicide-related calls, but really we're looking for people to call us before it gets to that point. When a person is having an emotional crisis or a mental health crisis, or they have physical needs that they can't find the resources for, that's what we're doing. So our volunteers, and our crisis line is completely volunteer, well, almost completely, I manage sometimes. So, but it's volunteer manned, and those volunteers receive a good amount of training to get to that point. So that's our first line. We are there to talk to people who are in crisis, people who are having suicidal ideation, and help them move beyond that, hopefully. If necessary, we'll intervene to save them. Oftentimes the callers call us and they collaborate. I will never call the police or a rescue without first talking to the person I'm going to rescue. I want their permission. I want them to be part of the rescue, not a victim of the rescue. Because while it'll keep them alive, it's not a nice process. So that's where we start from. The other part is that we try to form partnerships with community organizations to increase awareness of suicide, to change the way we think about it. And also, at times, certain organizations like the hospital, the emergency room, or emergency responders will ask us to follow up with someone and just make sure they're going to be okay. So that's something else we'll do, is that if someone is suicidal but we don't end up rescuing them or connecting them to other assistance, we may call them back with their permission again, and only with their permission. We may call them back and just check to make sure they're okay. The next part of that thing we do is training. And I try to do training wherever I can on one of a couple of subjects related to suicide. The first one is destigmatization, or removing the stigma from mental health. Mental health is part of our overall health. Mental illness is an illness. And here's the thing about it. all the symptoms of mental illnesses are really normal characteristics at extremes. So we want to reduce the stigma and let people know that it doesn't mean anything, that it's not a problem, it's just an illness. And then we also do training on how to recognize when a person might be suicidal, how to intervene if they are. And the funny thing about that is, how do you intervene, or how do you recognize when someone's suicidal? The easiest way is to ask. It's the thing everyone is afraid of. At every training I go, I ask, have you ever asked someone, are you thinking of killing yourself? Are you thinking of suicide? The first question is better. Are you thinking of killing yourself? I don't ask people, are you thinking of hurting yourself? Because very likely they have reached a point where they see suicide as a way of reducing the pain that they're in. We think of suicide as a selfish act oftentimes, a choice. But the reality is it's a symptom of a mental illness, and before a person gets to the point of actually making an attempt, they have tricked themselves. Their illness or the condition they're experiencing has convinced them that they are going to help people around them, remove the burden. So when we talk about suicide, we talk about it as a symptom of a mental health condition, not always an illness, but a mental health condition. And I will do that training anywhere if anyone wants it. I think they're going to be putting up numbers. Call the crisis clinic or go to our website, and I'm happy to go for any organization and do it. As far as what resources we need, well, first off, let me start with where we get our resources.
Yes.
And in resources, we tend to think money. So Kitsap Mental Health is our primary funder. They do it through undesignated funds that they get, not through Medicaid dollars. United Way is our second biggest funder. And then organizations like One Call for All on Bainbridge Island, which provides funding for us to serve and help people on Bainbridge Island. And then we get a lot of individual donations. A lot of people, unfortunately, after they've lost someone, will donate with us. Sometimes it's someone we saved, which is the better side of that.
Yeah,
but we do donations. Now, as far as what resources we want, of course we want money. But I'll tell you, I'll take a volunteer over money every day of the week. Volunteers is what we need, just plain and simple. Someone who wants to make a difference to their community. If you're feeling blessed, give back to the community. That's all it is. And I will guarantee you'll have a challenging yet rewarding job volunteering with us. If you don't think you're ready to volunteer on a crisis line, then volunteer with another organization. The Suicide Prevention Coalition, they need people who will go out and speak to other people. It's easier to get people to give money than time. But really what we need, the crisis clinic needs, is time. So that's my spiel.
Thank you. Thank you, Kelly.
And I'm now going to introduce Chaplain Holloman.
I could be a chapter, it's all good.
Yeah.
I have to say, sitting here, I have really enjoyed listening to the things that each one of you have said, because the military really is a microcosm of all the things that you're talking about. Let me talk about myself just for a moment. I'm a Navy chaplain, and I've been in the Navy for a long time, as you can tell by all the colorful things up there. And I've been doing this for a little bit over 20 years now. And the Navy really cares about suicide because it's about people, and people that's our primary resource, is what we have as people. And as each one of you have talked, I'm listening and I'm saying, yeah, that's what we do. And those are the very kinds of things that we do. The Navy Region Northwest, which is the primary Navy folks that you would encounter here, we have about 13,000 sailors right in this area. We have 4 primary bases. But when you include all of the dependents, the civilians, and the retirees, we've got about 100,000 people in the Navy family here in the area. So we're in all of those different places. We have kids in the schools. We have teenagers. We have retirees. We have people like me who are still in. And the Navy is a really diverse group. We probably have people here from each one of the 50 states. Who knows how many foreign countries people are from. We have men and women. But the thing that they all have in common is that very few of them are my age. Mostly they're really young. I'm in the top 1/2 of 1% age-wise in the military. All right? I know that because we keep statistics. Most sailors, on the average, are just under the age of 24. So they're just starting their lives as adults. They're away from home. They're away from all of those parental influences. And really, they're like as if they were in college. They have all the same things that college kids need. And what the Navy provides for them are all the things that a college would provide. So the chaplain's part of an interdisciplinary team that includes civilians, healthcare folks, chaplains, mental health specialists, counselors, folks that work with your kids. We got the whole team. We're all right there. We do all of those good kinds of things as we work with folks. And what we try and do, you're talking about people and resources, that's what we do. So the Navy has as its bottom line program, the one that everybody's going to do every year, whether you like it or not, whether you sleep through it or not, we're going to try and put you through something called general military training. And we're going to teach you to ask, to care, and treat. And the whole business about asking, I'm thinking, I know this program. That's what we do, because we teach people, we train them. The chaplain or somebody else will be standing in front of a room, and I will make everybody in that room ask the person sitting next to them, are you thinking about suicide? Statistically, it's a pretty good sized number that actually are going to answer yes, even though it's just a training environment. So we make people ask. It's not going to make anybody commit suicide. It's not going to plant an idea. People already have the idea if they have the idea. But we want folks to ask. And then what do? Well, you care. That's the whole part about people and resources. So we teach them, what do? You don't go off and leave them. You don't say, oh, that's too bad, I have to go to a football game. You do something. So you treat them, which might mean taking them to medical, it might mean taking them to the chaplain. But you don't leave them alone, and you don't blow it off, you do something with it. But then we have another level of training, and it sounds an awful lot like what you're doing with the folks in the schools, where we teach something called Safe Talk. And Safe Talk comes from a commercial company up in Canada. And Safe Talk, like all other things in the military, is an acronym. And it stands for Suicide Awareness for Everyone. And then talk is about tell, ask, and there's an L in there, listen. And then you got to keep folks safe. So we're going to make sure that everybody in the Navy has this whole idea of ask, care, treat. We're going to take a certain group of folks and encourage them with our Safe Talk program. And then we're going to have another group of folks who are even more interested in preventing suicide. And we're going to put them through a 2-day program called Assist. And these are not professional suicide folks. These are not medical folks. These are just people who say, I care. I want to know what I need to know. So we're going to put them through that. And that's just what we do at the local level. You talk about resources, big Navy, Washington, D.C. There's an entire crowd of people who study suicide prevention and are engaged in it at really senior levels because the Navy cares. For us, it's a leadership issue. When you take care of problems before they get out of hand, you usually don't have as much suicide problem. So all of these things you're talking about in the civilian world, we're doing that in the Navy. In terms of resources, thank you taxpayers. You provide all those resources for us. We appreciate that. And the Navy invests in that because people are our primary resource. That's what we have. And the Navy really cares how people are doing. So what we're looking forward to in each year is doing better with what we have. We'll put out something called a playbook from the One Small Act folks in Washington, D.C. And it's all about, here's what you need to know. Here's what you need to do. Here are things that you can be involved with. So we try to have really a wall-to-wall program that keeps people alive. To because that's what we do. So I'm just really excited hearing that a lot of these things are available in the civilian world as well.
Excellent.
All right.
Thank you, Commander Holloman. So I want to thank you all for your time, for participating today and giving of your time, and thank you for your time in tuning in to hear this important information. September is Suicide Prevention Awareness Month, so this is very, very timely and important for us to have this conversation. I would ask that you, whether you are a parent, a friend, a teacher, a neighbor, a volunteer, a mentor, no matter your role, join us in this conversation in this public health issue of suicide and ask the question when you need to. Thank you.